Well, hi, everybody. Thank you so much for joining. And I know it was short notice for some of you. I know other people have tight schedules, so people have to jump on and jump off. Totally understandable. Really appreciate you making some time. What we wanted to do is, we're in completely uncharted waters in a pandemic like we haven't seen since probably 1918. Everybody's lives have been tossed upside down. Every industry has been tossed upside down. And, Joelle's been in touch with you. I've been in touch with some of you. We're hearing some things anecdotally. And what we wanted to do is just get from all of you your perspective of how things are going, how this is impacting your delivery of services. So we thought maybe the way we would start is just give each of you 2 or 3 minutes to just kind of let us know, how is the pandemic impacting your service delivery, and how do you see that the pandemic has also impacted substance use disorders and the folks who are presenting to you. And if there's anything else you want to throw into the mix, that's fine too. So, why don't we just start? We'll start with Patrice. And then, we'll just go down the list. Forgot to mention from our team, we have Greg, we have Dan, we have Tom, and we have Joelle, of course. So I think you all know each other, but please just when you start your remarks, please just say who you are and what organization you're from, just so the folks who will be listening on the Senate website will know who you are as well. So Patrice, why don't we start with you?
Yes, good afternoon, and thank you, Senator Harckham, for giving us this opportunity to talk about what is happening in our field. I'm Patrice Wallace-Moore. I'm the CEO of Arms Acres. I'm also Vice President of Arms Acres and Conifer Park, Liberty Behavioral Management. And so both of them are substance use programs that deal with both inpatient, outpatient, as well as OTP programming. So again, thank you for giving me the opportunity to share about how the pandemic has impacted our field. For me, I have to say that when this first started, probably very much like our whole federal government, there was just an unknown. We didn't really have an understanding of what the expectation was. Originally, we were told that when you had masks, that the only people that needed to be masked were people who were symptomatic, who might be experiencing, cough, different fevers. And it seemed like within a week or two, we went to that everyone needed to be masked, but there was not enough equipment around for patients and staff to be properly protected with masks and all the other necessary PPEs. I have to say that I reached out to Mike Piazza. He's done an absolutely phenomenal job in Putnam County, keeping us abreast of what we need to do and how we can connect. And the meetings that we've had on a regular basis, weekly, have really helped. I mean, there was one day, I think Mike and I were on the call, like we're both going home late one night, just trying to figure out what to do. I'm glad to say that right now I'm pretty well taken care of as far as PPEs, and can meet with my staff. I have my staff signing off on what we need. We have masks, we have gloves, we have the outer coverwear like lab coats, the full suits. We have hand sanitizers. Their shields. So we have a lot of things that I think to help our staff and our patients, save our patients. We have enough masks for our patients. And so we've come a long way. I think we've taken a lot of lessons from this, hoping that in the future, if this hits us again, we'll be better prepared for it. But I think it's been a learning mechanism. Every day I had to meet with my staff and send my staff out to meet with the other staff. We got hit with a lot of staff members who were positive, a lot. Actually, the first group of people that were positive were not our patients, it was our staff. And we have had probably in total, since the first day, we've had a total of three positive patients in our building. Conversely, we've had well over 50, staff. who we experienced. That's probably between going in and out of, different things that people have been experiencing. Luckily for us, we've not lost any staff members to this disease. We've had some staff members that lost family members, but we've not lost any staff members. And, it's been very scary. It's very scary when any staff tests positive, any patients test positive. But Putnam Hospital, patients that we have had, Putnam Hospital has been absolutely phenomenal in helping us with this process. So it's been a learning experience for us. It's been kind of tough, kind of hard similarly. They've had a few more patients that experienced that and a lot less staff. They've gone through their own issues, but in both of our settings, we're still trying to provide treatment to patients on an inpatient level as well as outpatient. Telepractice has been phenomenal for our outpatient, our OTP, as well as our outpatient sites. And we've been able to provide a tremendous amount of service. We've utilized our outpatients a little bit more effectively to help our inpatients by doing a lot more screenings for anybody that's downstate before they come upstate, just to make sure that they're safe. We just recently, last week, got test kits. So now we actually have the ability to test patients in-house. It took us a while to get there. So I think all of these are positive, and I think we're in a much better place than we were 8 weeks ago when this first started for us. So, and everybody, the team, Allegra, and the advice that she's given our OTP has been absolutely phenomenal. So I think as a team, all of the different providers and the different systems have come together. And you constantly hear people say, we'll get through this together. I can honestly say that we have gotten to this point together with everybody's support. So, so thank you in that and giving me the space to share that.
Sure. Anne Marie.
All right, thank you. Good afternoon, everyone. I think for us, very similar to the person who just spoke ahead, is that our workforce was the hardest hit during this pandemic. We were able, I think we did a really good job in keeping our patients safe, keeping the clients safe. We moved quickly, similar to the OASIS guidelines, to eliminate them leaving the programs, as well as having visitors coming to the program. But because staff were coming to and from, staff got hit really, really hard. Unfortunately, and I'm sure some of you might have heard already, we lost our medical director maybe 2 weeks after the pandemic started. We're not certain if it was COVID related. He was definitely here taking care of patients. And he passed away, I think, March 29th. And then maybe a week or so later, we lost a recovery support individual in one of our OMH programs. Our patients, we definitely experienced and got hard hit in Long Island City. What was known, DOH deemed it as community spread. So we were upwards of somewhere about 20 individuals, either in isolation or quarantine. Our team moved quickly. We definitely had the knowledge and the experience, having come from Health and Hospitals Corporation. We definitely set up our command center, had our COVID response plan kind of put in place, really was aggressive early in trying to get PPE. I think PPE was a challenge for many of our sites because some programs were not deemed eligible to receive PPE initially. I think we overcame that quite quickly, and thankful to Suffolk County's OEM, Office of Emergency Management. They really provided a lot of PPE for our programs out in Long Island, and then eventually in the city, their Department of Health caught up. I think telepractice was an excellent move for us to go to, and we definitely engaged a lot of individuals into telepractice, and we continue to see that grow. So that was great that we had that waiver that got into place immediately. For our patients, though, it's been difficult not seeing their children, not being able to leave the program. And so in the last, I would say, few days, we're monitoring and noticing the number of self-discharges. So when you talk about the impact, the potential for individuals who have not completed the program, kind of tired of being isolated or quarantined, so to speak, sheltering in place in our programs, and couple that with now receiving their stimulus checks in the mail, that's a recipe for disaster to kind of go out of the programs and, having not completed. What we're doing is everyone who self-discharges or even completes is part of our practice. We're ensuring that they're going out with Narcan and being trained with Narcan. I think the unknown for us is that we'd like to open. Our numbers are down in terms of residential because we, in the height of the pandemic, we started to send people home who had safe places to go, but now we have capacity. So we're working with Oasis and others around the state to look at what does it look like to open up and kind of following the guidance, what the governor is saying. But we have the space in some of our areas, but it's difficult in other areas because again, there's not a lot of 6 feet distancing in terms of dining room, in terms of groups and so on. So we're bringing telepractice to the residential program. And so again, the last would be the unknown as it relates to being able to test our patients as well as test our staff. We're doing other things such as monitoring all the temperatures. We hired what's known as a wellness nurse to make sure that temperatures are being taken. People are practicing social distancing and wearing face covering. We do have a supply of PPE, but it would be great to have it tested. That's all.
Thank you. And I'm not going in any particular order. I'm just going down the screen as I see people, Brady Bunch style. Michael, why don't we hop over to you?
Which Michael? Michael Piazza or West?
Michael Orth.
Okay, thank you.
Sorry about that.
As twins.
We do a lot of tag team, Mike and I, so we're used to it. Well, my name is Michael Orth. I serve as a commissioner of Westchester County Mental Health, and with me is Delia Austin, who's our director and more intimately involved with the agencies. I just want to thank the Senator for your leadership in pulling us together. And I have to say in Westchester, we're fortunate to have wonderful providers who've really come together, been resourceful. Our entire behavioral health system has really stepped up to the plate and been responsive. I think as in Putnam and Westchester, we've had weekly calls with our providers, including inpatient, outpatient, and peers. There's been great collaboration. We've had to shift resources as some hospitals go to more of a med-surg need. We've changed and adapted the size of units. Everyone is creative and supporting each other. We also set up early on an emotional wellness hotline. This was probably the first week in March. We've received over 350 calls for all sorts of behavioral health issues. And we see the impact, the financial crisis, the relationship issue, the increased drinking and substance misuse has occurred. And we've been able to refer people to the various services. And we've also been able to recruit about 60 pro bono therapists in our county to help respond to some of the needs. We haven't seen a significant increase in psychiatric hospitalizations or outpatient, but my concern is this: we know this is going to be an ongoing journey, and as we get the calls and we hear the frustration, the anxiety, the self-medicating increasing, I can see in the future we will see those numbers increase. But I want to give Delia 2 minutes to talk a little bit about what we're seeing specifically with the SUD side. Delia?
Yeah, thank you, Michael. Thanks for this opportunity, Senator Harckham. We do appreciate it. In following up on what Michael indicated regarding shifting of resources, we're pretty heavily hospital-based when we look at our inpatient system. They're connected to other medical providers. So what we really saw was our SUD system. They switched some beds over from SUD to the medical model. St. John's Riverside was hit really hard on the medical side, but they were able to keep up at a significant level of their substance use beds. So that was dedicated. Phelps basically switched over their medical beds to their SUD beds to their medical beds. So that's what we saw. But we had sufficient capacity within the county that if a bed was needed, there was space available to serve the inpatient population. In terms of our staffing, our staff was really hit hard, not only in terms of being positives, but some of the mixed messages that we had gotten in the beginning about when staff was able to return to work, the time frame that they had to wait, and just initially getting tested. In the beginning, there was confusion about who was essentials and being able to access testing. The SUD system was not able to access it, I think, in a timely manner. All that has changed, but it's certainly in the beginning that was a problem. We still continue to have access around PPEs, especially when we're looking to reopen. We certainly want to have a supply of PPEs so that as we reopen our physical structure, we're able to make sure that staff is safe and secure. So that continues to be a problem, and not for everyone, but for some of our providers.
All right, thank you. I'm sorry, go ahead.
In terms of telehealth, that's really been a lifesaver. We've had some in our population that took to it and some that didn't. But if there could be an opportunity, I know we had waivers to be able to do telehealth. If that could be continued, that's just another tool in our toolkit that some staff and certainly some clients will avail themselves more often than others. So I think that's something that we should really look to continue to have that available. And we certainly were appreciative of the addiction waivers, that we were able to receive in terms of being able to supply clients with buprenorphine, not having to do on-site or to do in-person prescribing for that first face-to-face visit. So that was also helpful. So I think that's for in terms of what others on the Zoom meeting had to say. It just kind of crystallized all our issues and all our efforts. It certainly was a partnership in getting all of our resources together and answering all of the responses. And certainly OASIS was responsive to our needs and hearing our concerns and making adjustments so that we could actually function the way we needed to function.
All right, great, thank you. All right, let's hop over to John. I think you're still muted. Greg?
Thank you.
There we go. Thanks.
Yeah, thank you, Senator, for hosting the meeting. I guess I want to just emphasize several points. I think, first of all, one of the most immediate concerns early on was and I think Patrice touched on this, was, first of all, just the lack of consistent messaging from one point to the next, which was dictated very much by the environment. We didn't know a lot about what was hitting us. We didn't know a lot about what the approach was going to be. And, we were just kind of waiting for direction from the state agency and from the governor, et cetera. And I would say early on, there was a real obvious impact of OASIS not having the sort of stature that one would have hoped for. So while we were in the midst of hospitals complaining about not getting PPE, once it started to flow to counties, what we had initially been told was contact your local Department of Health. We contacted local departments of health, and then the local Department of Health would say, call the State Department of Health. And so there was a lot of lack of coordination early on. And then subsequently, the service providers from a county to county basis really had very different experiences with their health departments and also in interactions initially with the State Department of Health. Now, again, it improved with time, but one of the things that was clear, and this dates back to Hurricane Sandy, is that there's and this is something, Senator, that you may be aware of, and if not, it may be something that I think might require some kind of statutory change. There's a emergency management committee that's been established within state government where the different state agencies are convened and they address the crisis. OMH and OPWDD and a whole bunch of other state agencies are part of that group. OASIS is not. And I believe that at the time of Hurricane Sandy, that was an oversight. And here we are, years later, and it was never rectified. Now, in fairness, it's not an issue that we ever raised because it was not on our radar, but here we are in a crisis, and the commissioner is constantly, fighting, having to, I think, elbow her way into the room for a lot of these conversations, I would guess. And I don't know that personally, but
We
if
can
you're
look
not,
at that.
Yeah, if you're not part of the group, you're not part of the group. And then you wind up, I know that she did give reports to that group on a couple of occasions. She indicated that when we expressed a concern to her. So, how it winds up playing out is, at the local level, people looking for masks, people looking for, PPE. And in some cases they were told, you're not on the list. We don't have your service provider system on our list of folks that should be getting this. And again, it just took time before that was all corrected. So what I would say is, regardless of what happens, I think it's extraordinarily important to recognize what a key role folks took. And Senator, we were up against the same thing at the national level. The SAMHSA had a guidance on their website, which sort of suggested that folks should not go to residential or inpatient settings. They should instead go to intensive outpatient settings. And in making that point, they suggested that there was really no evidence to suggest that inpatient and residential programs would produce any better results. Now, the good news about that is that we saw that guidance early on. It was brought to our attention by a national organization. We reached out to SAMHSA right away, and last week we were able to get that guidance changed, and we will have some ongoing dialogue with the Undersecretary to drive home the point. All of that being said, it's very, very difficult to be fighting a pandemic when you're always coming up, last in the ranks. And so right now, I think a lot of the difficulties have been overcome. People have, the equipment, but there's that constant sense of what happens the next time that there's a pinch. Will we be at the back of the line? And so right now, there's a lot of concern on we do a call every single day at 10:30. And the conversation has really shifted pretty significantly in the last week to the economic dimensions of it and the degree to which the governor will be likely to announce some kind of a draconian cut to the field. And there's, of course, a strong feeling on the part of the field that we should not have to absorb a cut, particularly since we're still fighting an epidemic. And not lost on a lot of us is the fact that when the governor sits down and looks at the trajectory of this disease from day to day to day to day, he was very quick to start congratulating the state for the amazing work to see a decrease in opioid overdose deaths, which was pretty significant, statistically insignificant at the time. And if you look at the graph, you got this sharp upward trajectory of overdose and overdose deaths. And here we are, with 1 year, and we're it just does not gel with the same kind of conversation we're having about this pandemic. So the final point I would make is that what we're seeing right now, very, very, very interesting. It's very much on target with the recent research that said for every 1% that unemployment goes up, the opioid addiction and overdose goes up 3.5%. And when we look at New York State's unemployment rate going up 14%, and we see a 43% spike in overdose deaths in Suffolk County and 53% spike in overdoses that did not result in a death. And we've seen that in multiple other counties. There's a real concern right now that overdose is spiking. We know that the sale of alcohol is kind of gone through the roof, and nobody's surprised in our field that you start then hearing about increases in domestic violence, increases in child abuse, property theft, et cetera, are all significantly going up. And so I think it's really important that we kind of make some policy headway here to just call attention to the governor's office, which again, I think in a press conference over the weekend, one of the reporters asked a very direct question about our field, and the governor went back to it a little bit later on. So we're hopeful that maybe he's going to connect some dots here, but we really need your leadership on this stuff, and I appreciate this opportunity.
Sure, thanks, Sean. And we're also going to go back to discuss more of this overdose issue as well. So thanks for raising that. And we'll do it later in this meeting as well.
Thank you.
Mike Piazza.
Hi, Senator. How are you?
I'm good, thanks. How are you?
Good, good. Thank you. Thank you for hosting the meeting. I thank all the providers in the counties that kept it all together and really kept things going when times were very, very difficult. Our role in the county, or my role, was to connect and coordinate with the providers, see how they were doing, try and help them in any way I could and support them, and in terms of what issues they needed. For us, we saw that our crisis calls increased, our mental health crisis calls increased, and our calls to 211 regarding help of all kinds increased dramatically. I'm glad that Patrice and Arlene are on the call, because I will let them talk specifically about, client issues and what they see. I know that one of my main concerns was how would we go into telehealth and telemental health? Would the clients respond to it? Would the clinicians respond to it? I had a conversation with a clinician about 2 weeks in, who said that they were surprised that they were actually enjoying it. They felt they were connecting and they were engaging. Their clients were keeping up. So I'm really, I think we might learn a great deal from this that we might want to take into the future. I do want to address one point which I thought was very important, that I wanted to bring up too, that John had mentioned. And that was one of the frustrations I had was the ability to help the agencies getting the PPE that they needed. And, in the incident command control system, we were fine, in terms of, I knew it was my responsibility to get it for all of the O agencies and and OCFS agencies as well under DSS. But, in the blizzard and when we were out of power for 8 days, a couple of years ago, it was easier for me to go to CMO through emergency management and get generators for Arms Acres, who were on short power. It was easier for us to get those generators than it was to get PPE for Arms Acres this time, when I knew that their staff was getting sick, and it was information that we were sharing with the health department, and everybody was frantic, and that was, that to me was, I think we need to be, it's very clear, we need to stock up, we need to stack up, we need to be ready and prepared for the next one. As far as the future, and then I'll just leave it to everyone else to talk. We are concerned about the financial stress, what the financial stress is going to mean emotionally on people, whether it's acted out in drugs or alcohol, whether it's depression, and the feelings of shame that people have when financially they're in trouble, and certainly the media approach to, someone said to me at the very beginning, thank God the liquor stores are essential. I love this governor. This was someone who doesn't really love, was really, the idea that that alcohol was so promoted in the culture in these last 8 weeks has a real concern for me in the future. And one last thing, we're concerned, in terms of learning unintentional fatal overdoses, we get a report from the coroner every month. They're indicating to me that not all autopsies are being done because of the amount of deaths that were coming in. And I don't know what that means yet. I mean, I'm not, I want to hear a little more about what exactly that means, but that's something that we're going to look at in the next week or so as we get the April statistics for unintentional fatal overdoses. Thanks again.
Great, thank you. Allegra.
Yes, thank you. Thank you again, Senator. And I'd also like to thank you for the support, your support, and for your staff. It really has been, every bit the crisis that we all have been talking about. So Allegra Schorr and COMPA is the Coalition of Medication-Assisted Treatment Providers and Advocates, for those of us who don't know me, for those of you who don't know me. So the three medications, just to very quickly, so in addressing those three medications for OUD, so Vivitrol was fairly, was a little simpler in terms of reducing the risk of transmission, because people would just come in once a month, so we didn't have to worry as much because it was just for that one injection. And we were very grateful for the telehealth, as everybody has been saying. So that didn't get as much attention. And then buprenorphine, I'm very pleased to say again, The telehealth we were able to do inductions by telehealth and then telepractice. So the telephones have been incredibly helpful. So those two medications, we were able to really respond fairly quickly and effectively in those two medications. So I'm going to really talk a little bit more about methadone, which is really where more of the attention had to go and where more of the challenges existed in addressing the crisis, because the federal government has had said all the admissions, while we had a federal waiver to give more take-homes and reduce the risk of transmissions by having people come in less frequently than they would normally. We still had, of course, to do admission visits. Those have to be done face-to-face. So everything you've been hearing about the lack of PPE, I would concur with completely. And that would also not only face-to-face by our medical staff, but involves a physical exam. So while we're able to, to the best of our ability, maybe limit some parts of that, you can well imagine the risk that our physicians and our medical teams are being put at and continue to be. So that's a federal issue. We're also limiting to some degree, as much as possible, toxicology and blood draws, but these are continuing issues, and I think toxicology is for pretty much everybody in SUD is an ongoing issue. So also one of the main things that happened in the for methadone, because we are an APG, which is essentially paid as people come in, and I really thank you for your support on this. We were able to pivot very quickly, because once we had people not coming in, we weren't getting paid. That's as simple as it was, and we got support to get a bundled rate for this emergency, and that's seems to be starting to work. We're still having some issues in implementing this because waiting for the managed care companies to kind of get up and running. I'm pleased to say we've had a couple starting it, but since March 16th, it's quite a bit of time now for programs to really not be paid in this bundle. So that's significant. And the other issue that methadone has in particular is for patients who were in isolation and just couldn't get to programs, we had to figure out how to get methadone to them. So the federal government gave a waiver, which normally you don't transport methadone at all, but they were like, yes, you can now, but we're not built for that. And these staff shortages that you've been hearing about, I would definitely concur with. I'm a provider too. We also had the same thing. Huge, I positioned nurses out, counselors started to, but so there, even if we were able to try that, this was not a time that could happen. And it's simply not a system that's built to do these deliveries. So I'm pleased to say, and I think as John's pointed out, this is also very much a local issue. The New York City Department of Health really rose to the occasion here with OASAS and built a delivery system and really put resources in. The City Department of Health is really responsible for, started with their homeless agency, delivering to these isolation hotels, and now is expanding to people that are at home. So that's now is up and running. We're still waiting for the governor's office, I think is where the holdup is at the moment, to get the final guidance for programs to actually be able to bill for this. So that's another holdup. So there's hiccups and a lot of bumpy road to put all this together, but all in all, I have to say that these kind of things would, I'm sure, take months and months to put into effect, and it's, I think, been an all hands on deck to really try to serve patients. One thing I would point out is the telepractice using the phones. It's certainly been helpful but there are lots of limitations to it, and not everybody even has phones, and people that do don't always, we still can't always engage. And even when you can, it's clearly not as, especially when it comes to monitoring medication, making sure that people are getting the just their health is okay. Clearly not as effective as this kind of audio visual that we're doing right now. So, as we start to think forward, and I think all of us are aware this is not going to be a quick fix, these are certainly concerns that we have to, I think, start to think about how do we do this in the longer term.
Great. Thank you so much. Thank you. Christine. Hi, thank you.
Thank you very much, Senator. I'm actually going to let Tracy start off for Legal Action Center. I know she's dying to talk, and then I have a few things I want to say also, but I want to let Tracy start us off.
I'm not really dying to talk. Like, if I had $1 for every Zoom webinar, maybe. Senator, again, thank you for doing this. As far as I know, your colleague committee chairs, if others are doing this, I don't know about it. I don't know what's happening in public protection or just the other committees. So thank you for convening this. I guess the thing that I would want to flag that we haven't really talked about is the COVID impact on criminal justice, the kind of major movement to get people who can be released from corrections out of the correctional environment, particularly if they're at risk, which they most certainly are, given the way that corrections is constructed. But this also obviously has implications for people with substance use disorder, opioid use disorder, coming out in this kind of rushed fashion. And that's kind of the intel that we're getting from folks who work on the reentry side, to ensure that people are able to be inducted or have medication to protect them from the risk of overdose. And so we know anecdotally, for example, that, many of the county jails outside of New York City are, historic low census. The question is, and the question overall is, you can get people out, but then what? What do they need? And we're hearing, for example, troubling number of people leaving with COVID or having other comorbidities that would have them end up in the emergency room, and their Medicaid is not active. This is an issue we worked on not just 3 years ago and got legislation passed to ensure that Medicaid was activated 30 days prior to release. But, if they had Medicaid when they went in, they should have it when they go out. So this is an issue that needs to be flagged with the State Department of Health and with OHIP about the fact that this provision, which is especially needed now, is still not working. I don't know if it's the exchange. I don't, it may be, I don't know how much of it is going on outside of New York City. HRA is certainly implicated in this, but overall it is a mechanism that the Department of Health controls. So that's something to flag. The other issue is with the rise of telehealth. There are also confidentiality concerns. We do a great deal. Christine is one of our confidentiality experts for particularly around issues for substance use disorder programs and organizations, and keeping that information safe. The opportunity for misuse, mishandling of data is especially high now. So that is where we're getting calls from all over the country for guidance about how to address that. And then, I think we all acknowledge, we all know, I think other people have forgotten that we were struggling mightily with an overdose epidemic as COVID came in. So that doesn't mean, that it went away. If anything, it's really forcing us to be as innovative as possible to ensure that the people that we were dealing with this first health emergency are going to be able to survive and thrive and be as healthy as possible in this current health emergency. So I want to kick it over to Christine if she wants to add something about the confidentiality issues and also about the CHAMP program, the Addiction and Mental Health Ombuds program that you were provided enormous leadership in helping to get passed, and just talk a little bit about what's going on there.
Yeah, thanks, Tracy. And yeah, again, thank you, Senator, for organizing this. And thanks also to all of the providers on this call who are just doing incredible work and, keeping service delivery up. And, we are very grateful to all of you. Yeah, so on the CHAMP front, the CHAMP has been a great program and that we work on. And we have definitely been seeing a lot of calls right now, people trying to access services and trying to navigate insurance is, now more important than ever. And, calls have been coming in where folks are just a little bit confused, or, I don't want to go to the hospital for detox. Where can I go? A lot of fears about where to go and keep themselves safe from COVID. And it's like a real balancing act. So, that's one thing that we are definitely seeing. And the staff that work on answering those calls over at CSS are just, doing an amazing job. And the other thing, I did want to touch on the confidentiality piece and also some of the activities from the federal government. I mean, we were seeing, some of the things that, first of all, Allegra spoke on some of these federal waivers and at the state that to kind of ease service delivery right now. Legal Action Center is trying to be a little bit forward thinking in looking at which of these were too restrictive to begin with and kind of thinking about how is there an opportunity to maybe keep some of these things waived going forward, even post-COVID, in terms of making access to medications a little bit easier, telepractice a little bit easier. On the confidentiality front, though, the federal government has issued some guidance to make telepractice a little bit easier, but we also very much want to keep in mind that privacy is of utmost importance. And yeah, we've been giving a lot of guidance in New York State and also nationally about how providers can kind of pivot to this full-scale telepractice, but while maintaining privacy. A lot of these big tech companies are involved in providing their platforms to deliver services, and data is out there. And once someone's privacy is breached, especially when it comes to someone with a substance use disorder where there is still a lot of discrimination and stigma, once that privacy is breached, it's out there. You can't really put it back in. And so that's something we are definitely trying to look at and help providers think about privacy while they're trying to do the enormous juggling act of shifting to telepractice, which I fully respect is an enormous challenge. This is something that a lot of people have been working on how to do effectively for years, and then all of a sudden it totally shifts in a week. So it's a big challenge, but we want to remember that privacy is really important during this time. And then, the last thing a few people have spoken about is support for the field as a whole. And, we are really thinking of this, because this is kind of our wheelhouse, thinking about it from a parity perspective. We want to really make sure that, the mental health and substance use disorder community is being supported in the same way as the medical community, and respecting that these services are just as important. And you know, I think that that really could be considered sort of a parity issue. You know, these services need to be supported and the providers need to be supported in the exact same way that the medical community is. And that's something that we really want to keep in mind. So again, thank you so much for organizing this, and it's great to hear from everyone else on the call as well.
Thank you. Thank you very much. Jonathan.
Senator, I don't have anything. It's just me from council staff.
Oh, how are you? Good to see you.
How
I'm
are you?
sorry I didn't
Sorry.
recognize your
Hi.
last name. I'm so sorry. How you
No,
doing?
it's okay.
Thanks for joining us.
No problem.
All right, I want to be respectful of people's times, and I have a bunch more I want to cover. So maybe we kind of go to like a lightning round with some of our answers. We don't have to get as detailed, but I want to follow up on this whole notion of the impact of the pandemic. And we talked about PPE, we talked about a whole host of things. What has been the impact on finances? Both if you're a treatment provider, if you're from the government side, if you're from a trade organization or advocacy group, what is the economic fallout from all of this?
I'll jump in on the public sector side. So not so much a problem yet in terms of the contracts. We actually have some contract relief for some of our state contracts. The city stuff is a mess, but that's a problem. And then there's also the mad rush for the SBA loans and trying to get access to the money that's coming down through the feds. There's a big, I think, back order on that, and systems aren't moving as efficiently. And then, just assuring staff that we at Legal Action Center are trying to do everything we can to prevent the necessity for layoffs. But it's a very scary time for those of us who are not-for-profits.
Yeah.
This is Patrice. And as a program that is, we're not a for-profit program, and I guess you can say that we've had to furlough recently, furlough staff. In our census max capacity is 191. We've been as low as 90, actually below 90, almost 80 at one given time, and it's been really tough. We were trying to hold off as much as possible before having any furloughs, but we had to start that. Actually, this week we started furloughing our staff, and so it's been kind of tough because it has that impact on financially, no matter who you are, where you're from. And so then the amount of cost that we've had to utilize to get a lot of the PPEs, we've had to incur costs on some of the supplies for the telepractice things, additional computers or laptops or whatever it is that we can. We did get some PPEs from Oasis, but and from Mike Piazza from the Office of Emergency Management, we got some things, but a lot of it we've also had to pay for, and so it's incurred a lot of costs. We have actually a COVID line item on our and most of the things that we purchase, so that if there's anything that we are able to get back through loans, we'll try. But for the most part, it's just been a real tough time.
Yeah, I would echo that on the outpatient and certainly on the OTP side. The rate at the moment, we're looking at programs that are close to closing, especially smaller programs where most of the revenue is coming from an OTP specifically, are really very much on the edge. And even with this reimbursement bundle, it is really just a Band-Aid, because almost 2/3 of the patients still need to come in more frequently. And so the revenue is still very, very low, far lower than it's supported by the system.
Might be an interesting thing, Senator, to work with the Mental Health Committee to identify, how many programs, and what percentage of the total service provider community does this constitute, but how many programs are in what either one of the state agencies would consider to be a fiscally fragile circumstance. And I know on our Wednesday calls, we have a sector of the conversation that focuses on finance and business. And we were talking about the prospects of a 20 to 40% cut, which is what's been rumored, in terms of the governor's spending plan. And there were a number of fairly good-sized organizations that said, we can't deal with a 5%, cut. A 5% cut's going to mean, really, going in and cutting some vital organs because we've scaled back so much over the course of the years. So there really is, I think, a capacity issue. And, the one thing that I've got to remember to send you a copy of a graphic of this, but there's this reference to the fourth wave of the pandemic. And the fourth wave is really the behavioral health, the addiction and the mental health issues, which will be around for much longer. The trajectory for how long does it take before that, for that to peak, and that peaks pretty quickly, but it subsides over a much longer period of time. So there's that question of, and there was just a study that I think that came out yesterday as actually in preliminary stages that's talking about deaths of despair and how much those have increased in related to alcohol, drugs, and suicide. So there will be a huge demand for services as we kind of emerge from the COVID, and we're already seeing spikes in overdose deaths and suicide, and so it's really kind of a two-edged sword. It's like, okay, we're already fiscally fragile, and the governor's going to be doing these cuts, and as Allegra just pointed out, there will be a number of programs that will absolutely close and shut down. And well, who are those folks? And the other thing is, if you peel back the onion just a little bit and say, all right, in terms of the fiscal fragility, if you look and say, okay, how many beds do we have right now in our system? And beds is just one measure compared to 5, 10, 15, and 20 years ago. And it's a substantial decrease. When you have programs like, Phoenix House having to, shrink because of fiscal demands. We have programs like Daytop, kind of disappearing because of, fiscal crisis, and so many others. It's like, hold on a second here. We're talking about a field that's really been under assault, really, from economic factors. And we are entering a period of time where there's going to be increased demand. We know it already. And everybody's saying we should be planning for it now. And what we're planning for instead is, how do we absorb a 20 to 40% cut? So obviously we want to be at the front of the line when any federal stimulus money comes down, and we got to just really work hard to make sure that the governor has an awareness about, what the reality is out there.
Can I just add something quickly to what John is saying? There's been a demand for SUD beds for quite some time. And the commissioner and different people have done a great job of trying to expand beds and capacity. The problem is, due to the social distancing requirements, those beds have already been decreased, because in order for programs like ours to practice social distancing, you actually have to decrease your bed capacity to meet the 6 feet. And not that we want to get rid of it, but we have to also understand that at a time when this opens up and there's going to be a need for people to receive the care they need, there are going to be less beds available to them because of the social distancing requirements. So that's just something to put out there.
Thanks. Anne Marie, what's going on with Phoenix House? What are you seeing?
I would agree wholeheartedly with what Patrice and John said. I mean, a facility like ours at Long Island City, at the height of this pandemic, we were at about 80% occupancy, 165 clients. At the time, we're now down to 117. And even with the 117, it's still a struggle to meet the social distancing requirements. So again, census is a big deal for us. And I think the question that's out there is, how is OASIS going to handle this deficit funding when our numbers have significantly decreased? I mean, across both Long Island City and Suffolk County, we're at about 50% occupancy. And so with those 820 programs, when you're billing the managed care company, coupled with the executive order to waive co-pays and so on, our programs are significantly seeing a decrease in revenue coming in right now. I can't quite tell just yet. The numbers are not available to me to see how telepractice has helped, if any. We're still kind of shaking those numbers out. But I think the other part as Patrice mentioned, is the need for reimbursement for the additional expenses related to COVID. And so there's been an outlay for electronic equipment, webcams and monitors and things of that nature, as well as the PPE and staffing as it relates to nursing. We're hoping that, again, we've been on numerous FEMA webinars that we can participate and possibly get some of those dollars back to us. But I think the big issue is going to be the significant reduction in census. We know when the doors open up, there's going to be a need. Can we actually go back to that number of 190 and 170 and 180 in a program like ours and continue the social distancing? So it's going to be determined.
On the outpatient side, when we talk about fragile agencies for community-based providers that have been operating on the margins already, and then you have the epidemic, the second epidemic, and looking at staffing issues and looking at utilization issues and the need to purchase more equipment, the telehealth hardware that's needed, and certainly the training of staff. We certainly need more state aid support across the board in terms of shoring up our programs to be able to operate as we move forward. In Westchester County, we've seen programs closed. We've seen some expansions in certain areas, but there still continues to be a need for services and for providers to be able to be fiscally viable. That's really important, and it's taken a financial stress on our provider system. And we really won't be able to know the full impact until a few weeks, maybe a month or so down the road, when they're able to really look at what their revenues and how that's coming in.
All right, thank you. Thank you. Mike, what are you seeing in Putnam?
Well, the main concern we have from the entire Conference of Mental Hygiene Directors is the proposed or the expectation that the governor is going to make 20% cut minimum coming down. And that is a concern. Actually, it's on the agenda for our provider meeting tomorrow to ask the providers how they might adapt to that, or what their financial plans are, or how they're doing. But that's the main concern for us. I can't speak specifically for the agencies.
All right, and Christine, did you want to add anything here?
No, I think, I was just interested in hearing what everyone else was saying, but I think Tracy covered what we would add, and thanks again.
All right, thank you. Let's jump to what some of you mentioned early on, this issue of overdose. We've heard the figure of 43% overdose in places around the state. I don't know if that's a statewide figure, that's a local figure, that's an estimated figure, but we're hearing anecdotally that overdoses are up in all of your respective areas and in all of your respective practices. What are you seeing in terms of overdose, and not just opioids, other overdose deaths as well?
Senator, we've had a number of calls where local mental hygiene directors were on the call, and they were talking about it. I want to say what comes to mind is Madison County, some of the counties on the southern tier. It's a statewide issue, first of all, and it tends to be increasingly a mix. I mean, I appreciate you asking the question about opioids. Synthetic stimulants are starting to surface in more, become more common, and there's been a number of overdose deaths that were not reversible because they did not involve opioids, and so there's a real concern that that there's this sort of harm reduction challenge now that we have naloxone with the opioids, and folks don't really understand that there are other drugs that people are using that are again synthetic drugs that people are not as familiar with, and it's causing a real significant issue. I know in Erie County, there's been a lot of media in Erie County and Niagara County, Madison, and some of the counties toward the southern tier. And then folks in it, I think with St. Lawrence County, it's not a big number, but it's a big number compared to what they've seen in the past. So it is, I think, a statewide concern, and it very well may be that there are certain hot spots, but it's very concerning, and it is. I appreciate you asking the question that way. And the other thing is alcohol. The number of deaths attributable to sort of alcohol related occurrences is going up pretty dramatically as well. So it's I just think it's a public health crisis.
Others? Can our county folks weigh in?
Actually, in Putnam, up until the middle of March, we had no unintentional fatal overdoses for the first beginning of the year. And the numbers are coming in really slowly. They seem to be less so far than last year. Whether that's an aberration in the ability of the coroners to get the information out to us, we're kind of expecting some discussion about that in the next week or so as we start looking at the April statistics. But it's a concern, it's a concern when it jumps, and it's a concern when it seems less than it should be. So we're not getting the right information.
All right.
I think I would add to that as well. I think that we need to push for the data. I think because of the COVID, pandemic kind of overshadowed, the opioid epidemic did not go away just because of COVID. The use of fentanyl was still something we were very much concerned. I think we wrote an op-ed maybe at the end of February, just thanking the governor for adding the issue of the synthetic analogs to be included, when he did his State of the Address. And so I just think we need to push for the data. We keep hearing anecdotes. We know that the sale of alcohol has gone up, but we don't have the information in the programs. And again, when you have people sheltering in place, people are not out and about as they usually are, it's difficult to get this information. So we need to push for it.
Okay. Anyone else want to weigh in on this?
I think one of the things that has also happened, and I go back with Anne Marie's position about how information is not necessarily readily available to us. What we're finding is that a lot of preventive services are not being allowed because of the COVID. So what ends up happening is a person is almost to the point of at a very severe place. So we're not even allowed to sometimes have, there's restrictions on patients getting into congregate care settings. And so if you're being told that you have to be at a severe state, you might have people that are trying to get to severe states just so that they can get into settings because there's, a position that's what they're being told, that they have to be sicker to be into these settings. And so people could make a mistake and actually end up overdosing because they're trying to be sick enough to get into a setting, and so like in Rensselaer County, there were a lot of overdoses in Rensselaer County within the past, I would think in the past month and a half. And so depending on the county you are in and what services are available to you, you could actually end up having people experience more harm than good. I've seen people that have died because they couldn't go to the hospital because the hospital won't take them because of the COVID situation. So people are not really getting the proper care that would have been able to get them to our levels of care sooner. And so a lot of them are in much severe situations before they get into our level of care. And that puts them at a greater risk for recovery.
All right. Couple other quick questions, and then we'll give everybody a minute for kind of some closing thoughts. The governor has suspended co-pays for mental health treatment, and there's talk about doing it for substance use disorder treatment. Good idea, bad idea? Patients versus bottom line of providers who are already struggling cash-wise. What are your thoughts?
Well, I think, Senator, we've been looking to see if there's something we could do on co-pays for a long time. I think it's a very good idea, and will really help people who desperately need to seek services at this point. We're also looking at and people who are maybe had coverage and now maybe looking at essential plans, because there'll be that gap right now where they've lost employment and are noticing that there's a lot of gaps in those essential plans on the exchange. So I think that's another place that should be thought of for no copays, and included when we're thinking about what should be looked at.
I think one of the things that's unfortunate when we start looking at, how do we make it easier for people to access services, is that frequently it's a sort of you have people who have an inability to do the copay, which is understandable, and then you have people who are providing a service where the rates are not sufficient to cover costs to begin with, and then getting the copay helps you to kind of get there. And the last thing you ever want to do is to say it's a bad idea to take away people's copays because it's going to help them. And it doesn't sound good when you say when you say it's going to hurt us. It sounds like you're against the idea. So it's really more a case of how do you sort of subsidize something like that, because it's not a case of an insurance company which is making billions of dollars a year, sort of having to kind of get back. It's a case of the insurance companies getting paid. Who's not getting paid is the service provider twice. So it's really, I think we fully support the idea of relief for consumers so that services are more accessible. But there's got to be a way that we pay for it so that it can happen.
I want to totally agree with John on that. I think it's a great idea, but we've already been hearing, I've been hearing about, with the mental health piece, insurers really not being great about it, and a lot of confusion, sending providers not getting reimbursed and sending bills to the patients because there's a disconnect with the insurer. And I think, as always, the most important point is to make sure the insurers are doing what they need to be doing in anything that happens. It should not fall to the patient, and also should not fall to the provider here. We got these insurance companies, exactly as John said, billions of dollars, and they need to be held accountable if in fact a policy like that is implemented.
I definitely agree with John. It's a double-edged sword. We certainly want to use every opportunity to increase access to services, but we can't lay that increased access to services at the feet of the provider system. So we definitely have to figure out a way to funnel additional monies to the provider.
Right. My thought in that is, if the managed care companies have the ability to still deny the services that are provided by the provider, and you don't have the copay, you're putting the provider at a very risk, the same risk that we're in dealing with this altogether. So we've got to come up with a way that that the providers have some level of relief, because some of the managed care contracts are watered down with the expectation that the recipient is going to pay for part of the services. And so when you already have a watered down rate based on what the expectation of the recipient is, and then now you take that away, and then the managed care company doesn't pay for that or delays in their payment, you put some of the smaller, specifically some of the smaller outpatient programs at great risk of being able to stay in service. Larger ones might be able to do it, but smaller ones might have a really difficult time being able to handle not getting those types of payments.
All right, we could talk about 8 million other issues, but I want to be respectful of time. So why don't everybody take a kind of a minute with closing thoughts, and then we'll figure out next steps when we want to communicate again. If we want to do something more formal like a hearing, you let me know what you think the best way to raise these issues and advocate. So why don't we start with This time we'll start at the other end of the screen. We'll start with Dahlia, and then we'll work our way up.
Yes, hi. The final point that I would want to bring across is with the proposed cuts. I know New York State is in a certainly a huge fiscal crunch, but to have cuts to our SUD system when we have facing 2 pandemics, and there's going to be more issues on the back end of all of this coming about, I think that's crucial that we not experience any additional cuts. That's my 2 cents.
All right, thank you. And thanks for joining us. Christine.
I want to again thank you so much, Senator, for convening this and hearing from us. And I think it would be great to keep in contact and keep talking about these issues. I think in closing, I would agree with that point about the cuts. I think that this is not the time when we're in a time of crisis to be cutting services for people who are really impacted. And I would also just say that, we need to keep our ear to the ground about being forward thinking about how we can continue to see some of the, waivers and lifted regulations that I think could potentially be a real benefit in terms of making service access a little bit easier. I think we need to figure out a way to, maybe study or evaluate which of these things really were necessary to begin with, and some things that we can continue even after the epidemic. So that's the one place where Legal Action Center is at. Thank
Great.
you again.
Good point. Thank you. Allegra.
Thank you, and thank you for your leadership and really getting this conversation in this new world that we've find ourselves in going. And I think to that point, I mean, obviously, cuts are sort of backward looking, and it seems to me, and I think to our members that that this is, things are tight, but we have to figure out a way to use dollars in a way that's effective. And so I think that means we have to learn from where we are. We know that things like taking that technology and things like medication that we know is going to be effective, and putting those dollars in where it's going to make the most sense, integration. And because when we know that if we just cut services and we see overdoses, we're going to find ourselves in another terrible situation that we just came out of, where the hospitals are going to be overrun, and we just, we have to move forward in a way that's going to be cost savings and effective. And I thank you for starting this conversation. That's where we see it going.
Great. Thank you very much. Let's go to Mike. Only one mic left.
Oh, makes it easier on me. Thanks. I would say that if you asked me on March 12th how we would get through this and what the system would look like today on May 11th, I would have, said I have absolutely no idea. The thing I'm struck with is the resilience in the system, and in the ability to provide the mission is to make sure that people with substance abuse issues get treated, to make sure that they are able to get detox when they need it, to keep them safe, to keep them healthy. And I do think we have some issues we need to deal with in terms of Narcan and overdoses and making sure about that. There's certainly not being Pollyanna about where we are. But I think that we showed sort of a system resilience that, no matter, that the mission would be met somehow. It may not be, the ideal, but I think we're just able to, make the best out of a bad situation. And I'm looking forward to the journey as it continues. And I think that the waivers were really important. And I think the state, it had a very important role to play with the waivers. So I appreciate that. And I appreciate you bringing us all together. Thank you.
And thank you, Mike. Much appreciated. John.
Well, I think the governor's emphasis on his daily press conferences on transformation and building it better are, where we need to be focused. I think one of the things is all of the positive experiences that we've had because of this. So, for instance, when we think about increasing access to medication-assisted treatment, having sort of telehealth involved, having patients who are coming into clinics to be able to maybe increase. What do we learn about what happens when people have take-homes? What has been the impact of decreased use of toxicology? And is there, that was one of the MRT. I think recommendations was to do less toxicology. Is it clinically necessary is a good question. So again, I'm not recommending that we adopt anything other than what has worked. And are there any regulations that currently are in place that were relaxed, whether that's staffing and QHP regulations, or whether it's regulations around medications, whether it's regulations around physical space? Have we seen when those any negative consequences from regulations being relaxed? And then I would say that as we look at the possibility of cuts, et cetera, the first place we should cut is any kind of a unfunded mandate, where there's a requirement that costs programs money to implement, that if you relieved it and we have a demonstration that it's not necessary, that maybe it winds up, helping people to save funding. And then again, I just think, like, what have we learned, and what would the field propose as how do we build it better? How do we build it stronger? I think that's where we really have to focus our attention.
Terrific. Thank you. Anne Marie?
Thank you, Senator, and thank you again for pulling us all together. I think the 3 points I would take away, similar to exactly what John just said, we talked about the transformation. I think our system going forward, those in our space should understand that we took care of COVID positive patients during this pandemic. And so we are an essential part, an extender of what we see at the hospital level. And that our partners at the local health departments need to understand, or better understand, what we bring to the table. And so some of the hiccups that we saw earlier on when this pandemic came about in terms of getting access to PPE and stuff like that, that can't happen again. We can't be so fragmented. And I think the governor definitely touched on that during the course of his briefings, that we are part of the system and we need to figure out how to work better. I'm happy to say that as SUD providers and mental health providers, we figured it out amongst ourselves to really support one another and help one another get through this crisis. I think the second point would be to push for the data, because the opioid epidemic did not go away just because of COVID. And so we really need to double down to make sure we have that information available, which will then inform the third part, is that our system can't afford a 20% cut across the board, because we know from other instances where you've had situations across this country like Katrina, it's going to take years. There's going to be a lot of trauma work that's going to have to be done, not only for just individuals, but even the individuals who are on the front lines of this pandemic. And so we're going to need behavioral health and SUD services now more than ever.
Senator, if I could just jump in for a second, I want to just follow up on Anne Marie's point, and something I think is very important for you to know. Very early on in our daily calls, Anne Marie has been an amazing participant. And when she first started participating, she was desperate, in my opinion. She needed PPE. She was facing all kinds of issues in her facility with people needing to be tested, et cetera. And she lost her medical director. And so there was this need for resources, and she reached out, and a lot of people reached back out to her somewhere along in the process, when some of the things that Anne Marie and Phoenix House needed, she had some extra, and she reached out to everybody else. So she's absolutely right. I mean, that was one of the proudest moments in terms of being in this field, is to see the way the field is very much a community, and people really kind of came together, helped each other, and we're good neighbors with each other. And that was just, you saw, as the governor says, sometimes, when you're in the thick of things, you sometimes you can be very disappointed, but other times you could be either pleasantly surprised or just, I knew we had it in us kind of thing. It was really, I think, something that was emblematic of what we've been through.
Great. Great. All right, Patrice, you're the cleanup batter.
Well, you know how they say, everybody already said everything I wanted to say, but especially Anne Marie. One of the things that I wanted to bring up is something that John said earlier as well, is really identifying our level of care as essential providers. Just from the standpoint of understanding that, when we need to be tested, we know a lot of our staff are on the front lines, and when we needed to get our staff tested, when I had a lot of staff that were testing positive, I had a very hard time getting our staff tested and even saying that we were essential workers. I do think that, when especially anybody that's really in a congregate care setting, we should have somebody that's setting aside testing for our services. I also think that when we wanted to try to get testing into our levels of care, we were told by some of the lab companies that we don't do enough business with you, so we're not going to provide you with testing kits because there's not enough business. I mean, to me, I thought that was really a tough thing to say when you're providing this level of care to individuals. I mean, we finally got it, but we had to fight, kick and scream. I just think that if we could get somebody to say that anybody who's in these levels of care, the congregate care, that they should have a testing available for their staff and testing available for the people that they're treating. I think it should be something that, we can't go, they can't go home. They're in there, and the staff can't say, I'm going to work from home when you have a 24-hour level of care service. So we've got to make sure that we have safe things put aside for the patients as well as our staff. The other thing that I wanted to just quickly state is that not only the relaxing of the regulatory requirements, I think the OASAS has done a phenomenal job of relaxing some of the regulatory requirements. But I think as we move towards the downside of this, we're going to have to start allowing people to really get treatment access care wherever they can get it. We shouldn't be trying to restrict people from going from this level of care to that level of care. There's already going to be a shortage of beds. So we're going to need to make sure that if people need to get in treatment, that they get it where they can get it as much as possible, and not trying to say that people have to be extremely sick to get into these levels of care. I do think that we need to have testing. I think at some point, most of these providers are going to need to have testing before people, I think the future is testing is going to be required before people get into these levels of care. I think that's what the future is, but it needs to be made available to us. And if we can do that, that would be great.
All right. Thank you all so much. This has been a great conversation. And I hope we continue this dialogue as we go forward. A, as we continue to sort of dig out of the crisis. B, dealing with the crisis within the pandemic that's been there all along. And then, as someone mentioned, how do we build it better as we go forward? So thank you all for your time. I really appreciate it. Please stay safe and stay well. Thank you.
Thank you,
Senator. Thank you so much.
Thanks,
Take
everyone.
care, everyone.
Take care. Thank you.